Welcome to part 4 of the brain CT trauma lecture, where we're going to talk a little bit about other lesions. We're going to go back to the parenchyma to study a very specific scenario of parenchymal hematomas. And we're going to start with this case. This is a patient that came after trauma, and you see a lot of hyperdensities in the subcortical white matter. And kind of back there also, close to the ventricle, you can see close to the corpus callosum. So this was read in the ER and said, oh, these are diffuse axonal injuries, which is what typically is seen in this subcortical white matter regions. And what happens with diffuse axonal injuries is what we have. The gray matter mechanically acts different than the white matter. They're just act different. So when there's a big acceleration, deceleration, they move at different motions. And between the gray and the white matter, in that place, you have the axons, which are coming out of the neurons. So if you hurt the axons, you can have a diffuse axonal injury. There's also blood vessels there. That's when sometimes they're going to also have hemorrhages associated to that. So it's kind of a stretching of the axon, and then you're going to have some vascular injury. But you can also have other lesions that can mimic it, like cavernomas or like septic emboli. So what is in that case we saw that we'll check the MRI, but let's talk about axonal injuries. So these stretching of neurons, you can grade them if you want it. They can be subtle and not be seen at all on CT. Sometimes you can see these little punctate parenchymal injuries, but the best image to see is MRI when we do these susceptibility weighted images. They're typically subcortical. But in the case we just saw, when we did the MRI and we did susceptibility, all of the lesions look like little popcorns. So this was not a diffuse axonal injury. This was actually a patient that had cavernomas. Again, that was the oddball. Now let's see the typical axonal injuries. So this patient did have a little bit of white matter disease all over the place. We call it diffuse axonal injury, and when we did the susceptibility, we also saw a lot of popcorns. Another cavernomatosis. So twice or 3 times in my life, I've seen cavernomas that have completely threw me off in patients with trauma. I call diffuse axonal injury. I call the neuritis. You said the patient is fine. It's really not a diffuse. So remember this cavernomatosis diagnosis. And these this is a case. See how similar it looks like, but they don't look now like popcorns. They're just more like kind of dotty and punctate, very peripheral. This is a diffuse axonal injury in a patient, one case. This one is also going into the corpus callosum, which would be the grade 2. And this one are a lot more prominent, and they can go to the infratentorial region, which is a grade 3. Sometimes they can also give you kind of strokes, but you can see in this diffusion images in the corpus callosum. If you're not sure what a diffusion image is, go to our MR physics lecture. And just as a bonus, before we finish all of these lectures, I want to show you a special type of trauma. This is we call it an egg on a shell trauma that happens only in kids. They have so much flexibility in their skull that sometimes they hit and the skull will just deform, just like you would an egg on a shell. And you can see in 3D volume rendered images how it looks before and after it has been corrected. So just to finalize the brain CT trauma, we reviewed that not all that glitters is gold. Not everything that looks like a hematoma is. Even though I really want you guys to know all the main hematomas, and for the boards, that's what they're going to ask you. Remember just to bear in mind that you could have other lesions that happen. We went back and we applied the concept that we had learned before on how to diagnose things with CT and with MRI. we reviewed differential diagnosis every time we had a lesion, and first put oddball cases before going to the five compartments where you can have intracranial hemorrhages. We saw the extracellular compartment or extraaxial compartment where you can have epidural hematomas, which are the biconvex lenses, the subdural hematomas, which are the ones that cross the sutures and have a crescent shape, the subarachnoid hemorrhage that can be in the convexities or in the basal ganglia and creep into the sulci, the parenchymal hematomas, and we reviewed in the parenchymal hematomas the possibility of having a coupe contra coupe injury and a diffuse axonal injury when it's only subcortical and looks like dots. Um, and then, as take home points, I want you guys to remember to look carefully at all the windows, look carefully at all your trauma cases, so that way you can do the right diagnosis. I hope you enjoyed it. Thank you.